Admitting a patient is the formal acceptance of a patient into a healthcare facility to ensure proper treatment and resource allocation based on their medical needs. Before admission, the clinician should first do an assessment and plan. The assessment evaluates the patient's condition through medical history, physical exams, and tests, identifying key issues. The plan outlines the treatment and care steps based on the assessment. This process is essential to ensure accurate diagnosis and effective care, covering symptoms, test results, treatment actions, and follow-ups. To admit a patient, follow the following steps. Navigate to the clinical module and select the doctor's panel. In the new window that appears, all the patients queued to the room will be available on the mini queue. Select the patient you wish to admit as shown. Click on the Actions button and select Assess and Plan. In the subsequent window, evaluate the patient's condition through medical history, physical examination, and tests. Then outline the treatment plan and care steps based on the assessment. Click on the Save button to save the assessment and plan. After saving the assessment and plan successfully, proceed to admit the patient. In the doctor's panel, click on the Actions tabs. Scroll down and select Admit Patient. In the newly opened window, select the ward from the drop-down as shown. The bed charges will be auto-filled based on the configured rated underservices. You may adjust the admission date and time if needed. To assign a bed, select the bed number and enter the name of the admitting doctor. Click the Admit button to admit the patient. To access the already admitted patients, under the clinical module, select the Inpatient panel. In the subsequent window, the system will display the patients currently in admission. In the View section, you can view all discharged patients, absconded, discharged alive, discharged dead, currently discharged in, and past discharged in. You can filter patients by ward and adjust the date as needed to access patients within a specific time frame. Then click View. Additionally, if your list is lengthy, you can utilize the search bar.